7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. We're going to be talking about podiatry this evening. We have Dr. Jonathan Selbst. He's a DPM, Doctor of Podiatric Medicine at Florida Foot and Ankle Care. The website is delrayfoot.com. Really great website, 561-638-8635. I'll definitely give out that info. Again, we're going to be talking about a wide range of topics this evening and a lot about wound care because this is something that's coming to the forefront. Unfortunately, diabetes isn't going anywhere, and I think that's one of the drivers, but I will ask the doctor about that. And any questions you have, we're live on Facebook, All County Healthcare INC, or you can give us a call at 1-888-565-1470. And we're here till 6:30 p.m. So without further ado, Dr. Jonathan Selbst,
hi,
welcome to the program.
Thanks for having me.
Thank you.
Great to be here.
It is great to have you on this adventure of help. And it's Selbst, like it's kind of like Phelps, but
with an S. That's
there
it.
you go. Thank
That's
you.
the best phonetic spelling for it.
Yeah, and everyone who knows who Michael Phelps is, so that's great. So tell us a little, the viewers and listeners, a little bit about what you do, your medical specialty, because there's a lot going on with podiatric medicine, podiatry.
Yeah, absolutely. The profession continues to grow. I'm a foot and ankle specialist specializing in all conditions below the knee, ankle arthritis, foot arthritis, heel pain, chronic wounds, diabetic foot care, a whole range of topics, really, that anything that can affect below the knee, I can help patients treat.
So below the knee, you're the guy in town. And tell us what your coverage area is. I know you have a few offices or an office in Palm Beach County, but you cover kind of a huge range, kind of central Palm Beach County, almost into central Broward.
Yeah, I go all over the place, but my main office is in central Delray Beach on the corner of Military and Atlantic. But I do service a hospital down in Broward County. I go to a couple of assisted living facilities in Broward and Palm Beach County. So my range of treating patients is all over South Florida.
That's great. It's great to have a doctor, who's able to, treat the communities that we have here in South Florida, and especially a podiatrist like yourself. I know you talked a little bit about it, but what are your typical zoning your areas of interest? I know wound care is really big, right?
Yeah, absolutely. Wound care is a ever expanding field in the world of podiatry. It's unfortunate, but diabetes in America is growing at a rapid rate, and with that comes chronic wounds that are difficult to heal. Managing patients from a medical standpoint as well as their lower extremity have to go hand in hand. So I do specialize in wound care, and I go to a wound care center down in Broward County at University Hospital and see patients there, as well as in my office. That's an ever-expanding field that I'm taking care of.
And it's great you mentioned University Hospital. We actually have a lot of doctors from University Hospital that drive over for the show. So it's only over in Tamarack,
Yeah, it's not too far away.
We broadcast through all of Broward County and even into Miami as well, and then a little bit, north, all of Palm Beach County as well. So I always like to mention that. It's an older hospital, good hospital. It sounds like there's a good wound care center there.
Absolutely. We treat, dozens of patients weekly. patients ranging from diabetic foot ulcers, arterial ulcers, patients who have venous insufficiency, swelling of their legs, develop wounds and ulcers, infections that need comprehensive care, and a specialized catered approach to get these wounds to heal. So we take care of it all.
Now, if you're in the older population, or maybe you're someone with diabetes, and how often should you be seeing a podiatrist? This is definitely someone you want to have in, like, I always say Rolodex, because I'm thinking now as I'm getting older, I'm piling up my Rolodex to see, you know, I want to know who's the latest and greatest who can help me out. Definitely. So is a podiatrist someone that, you know, we should be seeing if we have diabetes?
Absolutely. The American Diabetes Association recommends that diabetic patients see their podiatrist at least once a year. Now, during that evaluation, that initial evaluation, if the patient's found to have poor circulation or peripheral arterial disease, peripheral neuropathy, numbness of their feet, that would be a reason for the patient to see their podiatrist even more frequently, because those patients would be considered at risk for skin breakdown, ulceration, infection, etc. So those patients need to be seen on a more regular basis. But if any patient that's newly diagnosed with diabetes should at least be seeing a podiatrist at least once a year.
And I know we've had a few podiatrists on, but I'm actually going to ask you as well here in a second. Now, I've heard in the past that, you know, someone with diabetes may not know that they have a cut on their foot or a scrape on their foot, because over time, and correct me if I'm wrong or explain it a little further, they don't have the feeling in that area, in the maybe the bottom of the foot and the legs, because the blood flow has totally disappeared.
Yeah, what actually happens is diabetes is a condition where the body's not able to process blood glucose or sugar and take it out of the system appropriately. So the sugar builds up in the blood, and that eventually gets into the nerves, damaging the nerves, and patients lose something called protective sensation. So they could be walking around and step on a nail, have a rock in their shoe, and ultimately have an ulcer or sore on the bottom of their foot and not even know about it for several days, weeks even. I've seen patients show up weeks or months later and not realizing they had a big hole in the bottom of their foot that's now infected. It's amazing how that happens, but it certainly does happen. So any diabetics out there, you know, it's very important to be looking at your feet every day. Look at the tops of the foot, the bottom of the feet, in between the toes daily for any red spots, blisters, sores, etc.
And I know that's hard to do, because as I'm getting older, it's hard. I'm kind of, everyone knows I'm a bigger guy too, trying to lose that weight, but you know, it's hard to get the foot up as you get older, and you know,
that's why man invented mirrors. Put your foot up against a mirror and take a look.
That's a great tip.
There you go,
Dr. Selbst.
Or have, you know, a loved one or somebody else take a look. I mean, it's a simple task. It takes literally 5 to 10 seconds, and it certainly can save your foot, your leg. It could save your life.
Yeah, because once that area dies, it doesn't kind of just keep on going up the leg, and more things are going to die. I mean, I hate to say that word, but isn't that what happens over time?
Unfortunately, that is the case sometimes. If tissue becomes infected and what we call necrotic or gangrene, there's no way of reviving that dead tissue, and ultimately that needs to be excised. In some cases, excise results in amputation.
Well, if there's someone, a friend, family, or yourself, you have that wound and it just doesn't look right, you definitely have to check out Dr. Jonathan Selbst. He's a wound care expert. He's got a hospital he's affiliated with if hospital care is needed for the wound care, but I know he also does a lot in his office, and we're going to get to it. But it's Dr. Jonathan Selbst, DPM. So did I get that right? Doctor of Podiatric Medicine?
That's it, Doctor of Podiatric Medicine.
I've been practicing that podiatric. Gets me every time. I always say podiatric, and it's just not right.
Yeah, we'll get you straightened out.
Yeah, thank you. And it's Florida Foot and Ankle Care.
That's it.
DelrayFoot.com. Great website. I'm telling you, I always say that when doctors have a great website. If you don't hear me say it, I don't care for the website. So I'm telling you, there's a lot of great information on there. Everything starting out from what is a podiatrist, all the way on to the services that you offer. Everything that goes on athlete's foot, bunions, ingrown toenails, etc., all the way to wound care, and all the areas of interest are listed there. under services, that services tab. The number's 561-638-8635. We'll give that out a few times during the show. And I see you watching on Facebook. We got 7 viewers, so that's really good so far. And Dr. Selbst waving there. And
hey, if my mom's watching, hi.
Yeah, hi, Mom. I hope my mom's watching with your foot and ankle that we're trying to get better. That's a whole different story for a different day, but I'm experiencing firsthand, obviously, as a son, and it's tough, and you got to have a great, foot and ankle
Absolutely.
guy or gal or podiatrist. And you said you're from the knee down.
Yeah, from the bone right below the knee is called the tibial tuberosity, and below in the state of Florida, that's our scope of practice that we're allowed to take care of. And, it's a small area in regards to the entire body, but boy, do a lot of things come about in that area of the body. Ingrown toenails, warts, infections, arthritis, skin cancer even. I've seen a couple cases of skin cancer that we've diagnosed, melanoma, squamous cell carcinoma. A simple biopsy of a suspicious lesion, will give us the result that we're looking for and make the proper referrals to get that taken care of.
And especially here in South Florida, as we're out in the sun, we definitely have to check our feet as well for spots or things that just are unordinary, right? That's when you take a trip to the podiatrist.
Absolutely. I'm here basically to tell people that foot pain and even foot numbness is not normal. Lesions are not normal. Anything that looks suspicious, is not normal. People come in and say, well, this is hurting me. Is that normal? Well, no. Pain is the body's way of telling you that something is wrong. So whether it's bunion, hammer toes, plantar fasciitis, Achilles tendonitis, all these different things, pain is not normal, and we do have solutions for all of it.
And these are ringing a lot of bells because I watch a lot of sports, and man, in sports, everything goes wrong with the foot, ankle, Achilles tendon, and all the way up to that knee.
Yeah, that's right. And, a lot of us are what we call weekend warriors. Get out there on the weekend and hit the pavement, and things go wrong if we're not training, year-round or even during the week. So
I agree, and I used to be a weekend warrior. I'm trying to get there again, and yeah, it's tough. My last trip onto the basketball court, I broke 3 bones. So
oh, my gosh.
One of them was the 4th metatarsal on the left, and 2 ribs.
Oh, my gosh.
On the same fall. So definitely get back out, but I kind of wish I had someone like you in my Rolodex at the time because I'm still kind of hobbling from it. So I may have to come see you here in Delray at delrayfoot.com, Florida Foot and Ankle Care. Tell us where you're located because I know I have it here. You're on Atlantic Avenue. You're in the prime real estate. Is it Atlantic Avenue and Military, you said?
Yeah, the northwest corner of Military and Atlantic. It's a great location inside of a shopping plaza there. And we have same day, next day availability all the time. We keep slots open for patients who call with, pseudo emergent calls where they don't want to wait until next week. If you call your doctor and you're having a problem, they tell you, oh, we can't see you for 2 weeks. Well, nobody wants to hear that. So we make an effort to keep availability open for today and tomorrow. There's been instances where I've opened the office on a weekend for a patient that's called in. We're very tech savvy. We have messages come to our phones over the weekend, and we listen to them. And if it's urgent, we'll give the patient a call back. Patient called my office on a Sunday and with a broken toe. And after discussing it with him over the phone and getting the details, I decided, well, this shouldn't really wait. Instead of sending the patient to the ER and going through the whole hoops and bounds of trying to go through the hospital system, we went into the office, opened the office up. Patient had a dislocated toe. We were able to numb it up under anesthesia and put the toe back into position and basically set the toe. And there's techniques to hold it in place while it healed. And she did very well. But the point is, we're a small family-run practice. We have patients in mind when we make decisions and want them to feel comfortable. So that's what I would want somebody to do for me, if I'm in need.
And I think that's what we want to hear as a possible future patients. Again, Dr. Jonathan R. Selbst, 5175 West Atlantic Avenue, Delray Beach. It's the Florida Foot and Ankle Care Office, 561-638-8635 or delrayfoot.com. Dr. Selbst, hold that thought. We'll be right back on the other side and learn a little bit more about podiatric medicine.
County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Cool.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Show. We're here with Dr. Jonathan Selbst. He's a DPM, Doctor of Podiatric Medicine, Florida Foot and Ankle Care, DelrayFoot.com, 561-638-8635. We'll give out that info again. Hard to believe, we got right to that first break and we were really going. I wanted to ask you a little bit about your experience, education, and training. Tell us about your undergrad, medical school, and I guess after that a residency right here in Broward County.
Yeah, so I'm a native Floridian, born and raised, never left town. I did my undergraduate studies at the University of Florida, go Gators, even though we're having a bit difficult of a basketball season this year, but we'll see what comes of that.
I think you'll be back.
And then after that, I went on to do 4 years of podiatric medical school training down at Bayer University, which is in Miami Shores, Florida.
Of course, yeah.
And after that, I did a rigorous 3-year surgical training program residency at Westside Regional Medical Center in Plantation.
Very busy hospital there.
Mm-hmm.
You were telling me you were involved in over 1,700 procedures in those 3 years?
Yeah, within those
Wow.
3 years, 1,700 procedures, a lot of, I don't want to say sleepless nights, but, long nights.
Well, resident, they're training you, right?
Yeah, absolutely. But it was all worth it in the end, and, got great training, and here we are today.
I think it'd be fascinating to learn more and just have a program where you interview people about their residencies and just to get really in there someday, because it's an amazing process the way they train doctors to be able to do it all.
Absolutely.
It really is.
And the training today for doctors is second to none. The commissions on residency training have really done a great job to create these residency programs to make them all inclusive and broaden the scope of practice and the training, the types of surgeries and procedures that we're doing.
So 1,700 procedures at a very busy hospital over there in Plantation. You saw about just about anything? Everything, I mean?
Everything you can imagine.
Walked in there.
From
literally
open ankle fractures, car accidents, to infected diabetic wounds with creatures coming out of them.
Yeah. And I guess that would be like gangrene and other things.
It's
I've seen pictures.
It's unfortunate, but like I said before, there are ways to treat all these things, and in the right hands and with the right experience.
Yeah. So if you have something gnarly going on your feet, or even from the knee down, Dr. Jonathan Selbst is the one to talk to. DelrayFoot.com. I wanted to ask you, because you're a big You're big into bringing it to the next level. I always tell people on here we bring the latest and greatest in healthcare, and one of the things you're doing with chronic wounds has to do with some investment that you made in your office to help out circulation. Tell us a little bit about that.
Yeah, so basically I'm seeing a geriatric patient, not totally, but a portion of my practice is geriatric, and in that patient population, these people have vascular disease. It's called peripheral arterial disease, and it happens in diabetics. It happens in patients without diabetes, and basically I saw a need to be able to quickly and accurately diagnose arterial disease in patients' lower extremities. So we invested in a piece of technology that's one of the latest and greatest to perform in-office testing of patients' arteries and the blood flow coming down to their legs. And it's about a 25 to 30-minute test. Patients come in and we put blood pressure cuffs on their above the calf, at the ankle level, at the calf level, and on their toe. Take blood pressures and waveforms of the arteries at different levels, and we can make analyses based on what we're seeing. The blood pressure in the ankle should relatively be about the same blood pressure as in somebody's arm. It should be about a 1-to-1 ratio. There's a little bit of room for error, 90% in the ankle to the arm, and that's considered normal. But if we start seeing 50%, 40% in the ankle pressures compared to the arm, we know something's wrong. There might be a blockage in the artery along the way, and that requires a specialized referral to either a cardiovascular surgeon or an interventional radiologist who we work closely with. So just to give you a little story, I had a patient come into my office. She thought she had an ingrown toenail. Her toe was red and had a little bit of a sore to it, some discoloration. And one of her doctors told her she had an ingrown toenail. I did my evaluation and determined that I couldn't feel the pulses in one of her feet, whereas the other foot was nice and warm. I could feel the pulses. And I decided we should run this vascular test on your legs. We did it that day. She was very thankful that we did it right then and there, as opposed to sending her to another facility, wait in line, and we all know what comes with that. So we got it done right away. And sure enough, it showed very poor circulation in that one leg. I made the appropriate referral to an interventional radiologist. 2 days later, she was having a procedure to restore the circulation in her leg, which patients a lot of times ask me, well, if we do this test, what's the next step if we do find something? Is it a major procedure? And there are terrific technologies and procedures out there with minimally invasive techniques where they go in with wires through a small incision in the groin, access the arteries, and are able to open them up with balloons or stents, much like they do in the heart. So this patient in particular had a procedure. Blood was restored within 2 days. Her pain went away within a week. Her wound and her quote-unquote ingrown toenail started to feel better in 2 weeks, and she did fantastic, and she's forever thankful. So a key piece of technology like this at the office did wonders.
Yeah, and it probably saved her leg and maybe even saved her life.
Absolutely.
Peripheral arterial disease just keeps on going and going if it's left untreated.
Absolutely, and a lot of times, just like high blood pressure, they call that the silent killer. Peripheral arterial disease, or poor circulation in the legs, can also be a silent disease where patients don't have any symptoms and not know about it.
And you're doing that right in the office. You're the first line of defense right there.
Absolutely.
Right there in your office. Well, it's hard to believe we have less than 2 minutes left. I want to give out your info one more time. Dr. Jonathan Selbst, DPM, Florida Foot and Ankle Care, DelrayFoot.com, 561-638-8635. The address is 5175 West Atlantic Avenue in Delray Beach. You'll recognize that area. It's right near Atlantic Avenue and Military Trail right there. But if you want to go back to this show or any show, you can always check us out on Facebook, All County Healthcare INC, or allcountyhealthcare.com. Yeah, hard to believe, but we ripped through 30 minutes. We'll have to have you back on in the future.
Well, I'd like to come back. Thank you.
Yeah, definitely. Just one more time, age range of patients you treat. You do geriatrics, but it's everyone, right?
I go from 0 to 100, 103 even. My 2-year-old daughter had a in-step, in-toeing problem. Put some orthotics in there with a gait plate. She's doing great now, so we take care of it all.
So if you have any foot and ankle issues, all the way up to the knee, check out Dr. Selbst, DelrayFoot.com, and We'll see you next time on the You and Your Doctor Show.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinion